Now we will start the neck. The humerus has three neck. We have already told you that: anatomical, morphological, and surgical neck. So, what is anatomical neck? Let's see. It is a constricted part at the margins of rounded head. That means it surrounds the margin of rounded head, and it is a constricted part. What does it provide attachment? It provides attachment to the capsular ligament of shoulder joint. We have already told the head usually forms a joint with the scapula, glenoid cavity of the scapula, that is called shoulder joint or glenohumeral joint. So, where there is joint, there will be a capsular ligament. Here also there is a capsular ligament of the shoulder joint, but except there is different in two parts. Look at that. Superiorly, where the capsule is deficient for the passage of tendon of long head of the biceps brachii, and medially the capsule extends down, slightly downward from the anatomical neck to the shaft for about 1 to 2 centimeters. Let's see. That means superiorly it will be deficient for the passage of the long head of the biceps brachii, and in medially it will be extend below 1 to 2 centimeter. Let's see the anatomic. Let's see the capsular attachment, capsular ligament of the shoulder joint. Here is the capsular ligament, the blue dot line. Okay. Look at that. The capsular ligament of the shoulder joint is the blue dot line. It lies just in line of the anatomical neck. Okay. We have already shown you the anatomical neck. Look at that, just in the line of anatomical neck, but it will be deficit at the bicipital group. Look at that, there is a little bit deficient area. Look at that. Here the capsular ligament is deficient. There is no capsular ligament because here the passes of long tendon of long head of biceps brachii. So exception is two part. It is superiorly there is a deficit because here the passage of long head of tendon of the long head of the biceps brachii, and medially the capsular attachment is 1 to 2 centimeter downward. Look at that. Here the medially the capsular attachment is 1 to 2 centimeter down from the anatomical neck. Look at that, 1 to 2 centimeter down. Here we can see 1 to 2 centimeter down. That means we can say it again. The capsular attachment of the shoulder joint, it will usually surrounds or follow the anatomical neck. The capsular attachment usually follow the anatomical neck of the shoulder, but it will not follow in two sides. It is superiorly and medially. Superiorly, the capsule will be deficient for the passage of tendon of long head of biceps brachii. We have already shown you that the superiorly it is slightly deficit. There is no there will be no capsular attachment. So if we asked to draw the capsular attachment of shoulder joint, so we will draw like this. In the superiorly there will be some deficient, then like this, then in medially, this is the medial side, this is the lateral side. Medially it will be 1 to 2 centimeter down from the anatomical neck of the shoulder humerus. And the posterior view, look at that, it follows the anatomical neck, it follows the anatomical, and when it comes to the middle, it just lies 1 to 2 centimeter below from the anatomical neck. Okay. Then come to the surgical neck. It is another short constriction part in the upper end of the shaft below the greater and lesser tubercle or below the facial line. We can say it is a short constricted part in the upper end below the greater and lesser tubercle. What is clinical importance? We should know it is a very study for us. It is related to the axillary nerve and posterior anterior circumflex humeral vessels. So surrounding the surgical neck, we have got one nerve, that is axillary nerve, and two vessels, posterior and anterior circumflex humeral vessels. You can see in the figure. We have told already you that this was the anatomical neck, this was the surgical neck front view, and this is the surgical neck back view. And we read that there are three important structures surrounding the surgical neck. One is nerve and two vessels. Actually, the anterior circumflex humeral vessels lies in front of the surgical neck. This is the anterior circumflex humeral vessels, anterior circumflex humeral artery. It lies just in the anterior of the surgical neck, and the posterior circumflex humeral vessels and axillary nerve. These two structures usually lies in a posterior part of the surgical neck. So this is the posterior circumflex humeral vessels or artery, and this is the axillary nerve. This lies posteriorly of the surgical neck. Surgical neck posteriorly thakbe. Okay. So what is clinical importance? When we just want to read that, it is the most important feature of the proximal because it is weaker. This surgical neck, the part of the surgical neck is weaker than the more proximal regions bone, because it is one side where the humerus commonly fractures, leading to damage of the associated nerve and vessels. That means the surgical neck, this area is much weaker, more weaker than any other part. So when an injury occurs at the humerus bone, this side fractures earlier. So when this side of the surgical neck will be fractures, this will lead to damage of the axillary nerve and anterior and posterior circumflex humeral vessels. So what will be the consequences? What will be the effect if this axillary nerve and these two vessels damage? If these two vessels damage, there will be bleeding. Okay, there will be bleeding. And if this axillary nerve damage, there will be, the axillary nerve usually supplies the deltoid muscle. This axillary nerve supplies the deltoid muscles, and the function of deltoid muscle is the abduction of the shoulder joint from 15 degree to 90 degree. So if this axillary nerve is damaged, there will be paralysis of the deltoid muscle. So the function of the deltoid will be lost, or in summary, the arm cannot be, or the shoulder joint cannot be abducted from 15 degree to 90 degree. Okay, so I'm repeating it again. When there will be any fracture, the fracture usually occurs at the surgical neck because it is the most weaker part. When there will be any fracture in the surgical neck, it will lead to damage to the anteriorly anterior circumflex humeral vessel, and posteriorly posterior circumflex humeral vessel and axillary nerve. When these two vessels will be injured, there will be profuse bleeding. Okay, and when this nerve will be injured, this nerve supplies the deltoid muscle. So if the nerve is injured, the deltoid muscle will be paralyzed. So the function of the deltoid will be lost. The function of the deltoid was abduction of the shoulder joint from 15 degree to 90 degree. So in axillary nerve injury, there will be no abduction of the arm in this range. That means between 15 degree to 90 degree. Okay, this is the clinical significance. Then go to the morphological neck. It is not clinically so important, but we know about few lines about it. It is the junction between diaphysis and epiphysis. We have already told that growing long bone had two parts, epiphysis and diaphysis. The morphological is actually represent the junction between diaphysis and epiphysis, and it usually represents the epiphyseal line in the adult bone. It is a true junction of the head and shaft. We have to know that it is the junction between diaphysis and epiphysis, and it will usually represent the epiphyseal line. Okay. Then come to the greater tubercle. It's the most lateral part of the proximal end of the humerus, and its posterior superior aspect bears three flattened facets, like impressions, three flat impressions for three muscles. Upper, middle, and lower impression contains attachment to the supraspinatus, infraspinatus, and teres minor muscles respectively. And here is a very good meaning, that is sit. Supraspinatus, infraspinatus, and teres minor. Let's see how these muscles are attached in the greater tubercle. This is the greater tubercle. This is the front view. Okay, look at that. From anterior to posterior, at first lies the supraspinatus muscle. This is the supraspinatus, and if we look from the behind, this is the supraspinatus, then infraspinatus, and then teres minor. Okay, we can see the mimic. Sit, supraspinatus, then তার posteriorly থাকবে infraspinatus, then lastly থাকবে হচ্ছে teres minor muscle. Okay, then come to the Lasertubercle. Lasertubercle is a small elevation on the front of the upper part of the humerus, just above the surgical neck. It provides attachment to the subscapularis. It is important. So Lasertubercle attachment থাকবে subscapularis. Look at that. This one is the Lasertubercle, and it gives attachment to the subscapularis muscle. Here one question is asked in the Viva. These subscapularis, supraspinatus, infraspinatus, and teres minor, these four muscles is together called muscles of the rotator cuff. So if in Viva examination is asked what is rotator cuff, it is we will say these are the four muscles in the humerus, upper end of the humerus, that are the supraspinatus, infraspinatus, teres minor, and subscapularis. So why it is called rotator cuff, or what is its importance? The rotator cuff, these muscles surround the head of the humerus, so it usually gives strength, or it usually stabilizes or strengthens the shoulder joint. Okay, so how will you remember what are the muscles of shoulder joint? Like this mimics: sits, supraspinatus, infraspinatus, teres minor, not major. There are two muscle like naming teres, that is teres major, teres minor. So we will write here the small handed T. Okay, so we can remember supraspinatus, infraspinatus, teres minor, and last one is the subscapularis. This four muscle is called rotator cuff. Okay, then come to the intertubercle sulcus, and another name is bicipital group. It is a group between two tubercles. It contains, what does this contain? It is frequently asked in the Viva. Number one is tendon of the long head of the biceps brachii with its synovial sheath. Number two, ascending branch of the anterior circumflex humeral artery. Okay, let's see. So the bicipital group, which one was the bicipital group? Between two tubercles. Okay, so this one was the bicipital group, the red one. So what does it contain? The number one is tendon of the long head of the biceps brachii. Number two, ascending branch of the anterior circumflex humeral artery. Ascending branch. We have already said that in the surgical neck, in the front view, there is a passage of the anterior circumflex humeral artery. So its ascending branch So the ascending branch of the anterior circumflex humeral artery will ascends and it passes through the bicipital groove. So what are the content of bicipital groove? Number one is tendon of the biceps brachii with its synovial sheath, and number two is the ascending branch of the anterior circumflex humeral artery. Okay. Then three muscles are attached in the region of this group. There are also three muscles attached: pectoralis major, teres major, and latissimus dorsi. We didn't tell the bicipital groove has two lip and one floor. This space is bicipital groove. Okay, bicipital groove downward it has two lip. Look at that, two lip. This is lateral lip, this is medial lip, and the middle one is called floor. Okay, lateral lip, this is medial lip, and the middle one is called floor. The medial lip provides the attachment of the teres major muscle. Okay, teres major muscle, and the lateral lip provides the attachment to the pectoralis major muscle, and the floor easily contains latissimus dorsi. So we can remember this attachment of the bicipital groove by a mimic, that is two major guardian. Look at that. In the lateral lip, pectoralis major, one major muscle, and medially there is another major muscle, that is teres major, and medially there is a lady, that is latissimus dorsi. So you can remember like this mnemonic: it is two major guardian or lady between two majors. That means lady lies in middle, and teres major lies medially, and pectoralis major lies laterally. And this is a very common question asked in the Viva. What are the attachment of the bicipital groove, and what does contain it?